All right, good morning. My name's Anita Taylor, and I'm a local physician here in Helena, Montana. And it is my pleasure to introduce Dr. Lisa Patel. She is the Executive Director of the Medical Society Consortium on Climate and Health and Clinical Associate Professor of Pediatrics at the Stanford School of Medicine. She's also a member of the Executive Committee for the American Academy of Pediatrics Council on Environmental Health and Climate Change. Lisa received her BS in biology from Stanford University, her master's in environmental sciences from the Yale School of the Environment, her medical degree from the Johns Hopkins School of Medicine, and completed her training in pediatrics at UCSF. She's also a former presidential management fellow for the Environmental Protection Agency. And with that, it is my pleasure to introduce Dr. Lisa Patel. Thank you so much for the invitation. Lori and Rob are icons nationally in the climate and health space. So it's a real honor to be here and get to talk about climate change and health inequity. Before I get started, I just want to talk, I think for each of us, we had our climate awakening moment. And for me, it was two moments separated by a decade. The first was when I was working for the Environmental Protection Agency. We were doing a shared project between New York City and Mumbai, looking at children's asthma mitigation projects. And so I was in Mumbai. They took me to a hospital to look at the children's asthma ward. And then they took me to a gymnasium nearby because they had to rent a separate facility for the number of children that were suffering from asthma. And it was this moment seeing all those children struggling to breathe, where it felt like a real failure. Asthma is multifactorial, but we know that fossil fuel pollution really contributes to both formation and exacerbation of asthma. Well, 10 years later, I did all my medical training. I became a mom. And I kept thinking, over that decade of medical training, well, the grown-ups will take care of it. Certainly, we won't run civilization off a cliff. I have time. I want to focus on being a mom right now. Well, we withdrew from the Paris Climate Accords in 2017, and suddenly I realized that there was no time, that the grown-ups were not taking care of it. And then I went all in on climate health and equity from that point forward. So in terms of the lecture, I have no financial conflict of interest disclosed. You have the objectives listed there. I'm really going to focus on the harms of air pollution and heat in particular, in terms of what Montana will face in terms of climate change. Climate change is the way it's playing out. It is not equal. And so really thinking about climate change and the issue of health inequity, I think is very essential, particularly for those of us who practice health. And then we'll finally. Oh, yeah. Oh, sorry about that. Actually, I'll just minimize it. Yeah. Is that better? Yeah. Is there any way I can get that to disappear at the top? Okay. And then finally, climate change feels like a big problem. And I think often people don't get involved because they don't know where their place is in for it. So sprinkled throughout this presentation, I'll talk about what we can do as health professionals on an individual basis with our patients. And then we'll talk as well about both community and policy level action. So first, I want to start by setting the intention that climate change is here, it is now, it is us. 20 years ago, when I was studying ecology and evolution in college, climate change was framed as an ecosystem problem for the polar bears that was going to happen sometime in the future. But now we understand that it is here, it is playing out in every part of the world. It is now, so it's happening in this very moment, as opposed to being something that's in the distant future. And it is us. Yes, the polar bears are being affected, but also it is profoundly an issue of health for us as individuals. The health of every child born today is going to be affected by climate change. And so we have to ask ourselves, what kind of world do we want to create? Do we want to create a world where children can merely survive, or do we want to create a world where children can actually thrive? We know many of us, I think, in this room became motivated to act on climate because we read the IPCC report, we saw the data. It is distressing, it is depressing. And so I think it is important to know what that data is. But I think at the same time, it's important to talk about, this is our opportunity to actually learn from our mistakes and create a beautiful, clean, connected, healthy, and just world. If we could imagine places where people could walk, bike, everybody can live close to where they go to school, where their job is. You bump into people as you go to these various places that we have an opportunity to create thriving, connected communities that are clean and beautiful and inspirational. I won't have a chance, I only have an hour, so I won't have a chance to delve into all of the various health harms from climate change, but I did just want to take a moment as we think about globally what's happening in terms of climate change. Again, climate change is not something that's going to affect everybody equally. We know that the vast majority of it is going to be borne by those in the global south. And we know in this country, it's going to be borne more by those that live in rural areas, those that are poorer, and communities of color. So as we look across the world, these are just a few of the climate disasters we've seen in the last few years. In places like Madagascar, close to 1 million people are on the brink of famine because of a very severe drought. And people are reduced to eating things like locusts because there isn't enough food. We know that in our lifetime, many island nations will disappear because of sea level rise. There have been, last summer, there were historic monsoons. A third of Pakistan was underwater because of these huge monsoons that came and ravaged the country. In India, birds were literally dropping dead from the sky because the heat had gotten so bad there. Parts of South Asia are predicted to become uninhabitable. The health community is really united around climate change being a profound threat to human health. In September of 2021, 200 major medical journals, including the British Medical Journal, the Lancet, New England Journal of Medicine, published. Oh, yep. Can you unmute, please? Oh,
I think it's okay now.
okay.
Yeah. Published the same editorial on the same day, calling climate change the greatest threat to public health in the 21st century, and asking our leaders to do more to transition us off fossil fuels and towards renewables. A final piece of knowledge that I just want to add here, because I'll talk about this throughout the presentation in different ways. Y'all live in Montana, where I think the times of politics, unfortunately, climate change is a political issue rather than an issue. Oh,
now there's an echo.
Oh, no worries.
Is your sound on?
Yeah, mute yourself.
Mute myself.
Mute
Okay.
myself. So sorry. Yeah, no worries.
Everybody,
Yeah, that's okay.
get it?
Yeah. As you can see, there is a small segment of the American population down here at the bottom, about 9%, who don't believe climate change is happening, who are not movable. But the vast majority of Americans believe climate change is happening, and a pretty significant majority of Americans want the federal government to act on climate. We know as well that when we deliver it as a health message, it has the ability to build more bipartisan support that takes us away from politics and really grounds us in human health. But what I really want to highlight here, 75% of Americans are either very concerned or somewhat concerned about climate change. But then you look on this other graph about how many of us perceive that other people are concerned about climate change, and you see a pretty big gap there. I think part of that is that we don't talk about climate change nearly enough. And I think that is because climate change does feel like a big, overwhelming problem, and we don't really understand our place within it. And so, again, the intention I want to set here is what can each of us do to close that gap? How we fix the echo problem?
Yes.
Okay. Okay, I'll do a very brief primer on climate change. And I think most of you know this information, but I do like to tell this story when I talk to others about climate change and say why this moment in particular is so important. So if we go 10,000 years into our record, we see that we've had a period of pretty remarkable temperature stability in the last 10,000 years. What that has meant is that we've settled into predictable patterns of weather all around the world. The summer, spring, fall, and winter that we can expect in different places, but with some anomalies to it, but more or less predictable. And so around 3,000 years ago, because of that predictable weather pattern, agriculture developed at that time, more or less at the same time all around the world. With the advent of agriculture, we saw a boom in fertilization. with that boom in civilization, we needed to find ways to power forward what we were doing, and so we discovered fossil fuels. Now you can see as far back as 1912, somebody predicted that this was going to be a problem. When we burn fossil fuels, we both dirty the air, but we also release carbon dioxide that is warming the planet. So both of these, and today I'll talk about both of these pieces, the way fossil fuels affect health is because we're pumping more carbon dioxide into the atmosphere that causes warming, that causes a litany of harms like heat waves and wildfires. But the second thing that fossil fuels do, it releases PM 2.5, and I'll talk much more about this in the presentation. This causes direct health harms because we breathe it in and is a significant contributor to premature mortality around the world. And again, if we look back, we can see that there have been fluctuations in terms of the amount of carbon dioxide in the atmosphere over the past million years. But if you look at what's happened in the recent past, that line is going straight up in terms of carbon dioxide. And so it is both the level at which we are now, but it's also how rapidly that has changed. And so it's destabilized our atmosphere. And so what I like to actually describe is not to say that it was global warming. I call it global weirding. We're really embarked on this strange natural experiment where we've destabilized our atmosphere. And so now we are seeing these very strange anomalous events. No longer can we expect a predictable run of seasons all around the world. It's why you can see a polar vortex in Texas in February, or you see heat waves in places like Canada. The predictability is now gone. In terms of the drivers of greenhouse gas emissions, you can see transportation is a big one, as is electricity production. Industry, including the healthcare industry, is a pretty significant driver as well. Agriculture, so our dairy and our beef, and then finally commercial and residence is a significant driver as well. Any questions on that before I move on? And by the way, please feel free to ask questions during the presentation. I like to make it as interactive as possible, and then we'll reserve some time at the end. So if you have any questions, just raise your hand. All right, so now we'll talk a little bit about climate change and health. So as I mentioned, talking about all the health harms of climate change would take more than an hour. It would take maybe a year to talk about all of it. But I do just want to provide a brief overview about some of these other health harms. And then I'm really going to deep dive on air pollution and heat in particular, because these are two of the big issues that Montana is facing. But we are seeing more severe weather. My parents actually live in Texas, and when the power grid almost failed, had to spend the night in their car to stay warm because it was too cold to be inside their house. We're seeing more environmental degradation. For folks that have been following what's been happening in places like Louisiana and Mississippi, there's a town in Louisiana called Lake Charles, where they got hit with one hurricane, a chemical plant exploded, a second hurricane came through, and so communities don't even have a chance to recover before the next natural disaster comes through. Degraded living conditions and social inequities, changes in vector ecology. We're seeing a spread of habitat for both Anopheles and Aedes species, and with it a spread of dengue, malaria. Ticks are spreading as well, and so we're seeing Lyme disease in places that we haven't seen it in the past. Water and food supply impacts and water quality impacts. Jackson, Mississippi has been historically underinvested in terms of its water treatment and sewage lines. And then you add on top of that a series of floods that happen, and then you have a city in the United States of America that doesn't have potable drinking water. This is a report that Lori and Rob also took over that really looked at the human health impacts in terms of the Montana climate assessment, and really boiled down to three places that Montanans need to think about in terms of the impacts of health. So increased summer temperatures and periods of extreme heat, reduced air quality from smoke, as periods of wildfires get worse, and then more unexpected climate-related weather events like rapid spring snow melt, flooding, severe summer drought, more extreme storms. And like I said, I know wildfires is actually my area that I usually lecture on because I live in California, but I know there's a lecture on it later today, so I'm really going to focus on air pollution, drought, and heat waves. Let's start with heat waves. These are just a few pictures. So this is a street in India that's literally warped because the temperatures got so hot on that black asphalt. Large areas in the Middle East are becoming increasingly arid. This is an area that used to be that was previously arable, but because of really severe drought. People can no longer grow crops there. And this is just a picture of one of the heat domes that passed over the Northwest in terms of how high those temperatures reached. In terms of the health effects of this, I really like this reporting that came out of the Washington Post. This was a heat dome that happened in 2021 in Oregon and Washington State. They wrote, physicians raced to provide fluids to patients who arrived breathless, dizzy, drenched in sweat. Others were brought in on stretchers, their body temperatures so high, their central nervous systems had shut down. Those who could still speak told of stifling apartments and some that made their skin sizzle. Some had tried to walk in county cooling shelters only to collapse in the blistering heat. So they've done studies in terms of what the human body can handle in terms of heat. And the human body can handle 150 degrees with minimal humidity in light clothing at rest, drinking water continuously. And it topped 116 in places like Portland. It was 116 degrees at the community hospital where I work in Pleasanton, California. We had a heat dome just this last Labor Day weekend where I worked 2 24-hour shifts over that Labor Day weekend. And it was the worst worst 2 shifts that I've had actually in my memory in terms of the number of women that were coming in premature labor, the number of children that were coming in with respiratory distress. We know that climate change is driving heat waves of worsening frequency, intensity, and duration. And then when we think about what the health effects of this are, we know that children, elderly, the poor, and increasingly we have good evidence for pregnant individuals in terms of what the effects of heat are on their health. In a high emission scenario, and I should say that because of recent pieces of US legislation that we've passed, we're no longer in the high emission scenario, but just to give you a sense of how this affects health, in that high emission scenario, if we don't achieve this transition, their heat could be responsible for more deaths than all infectious diseases combined by 2100. As I mentioned, climate change doesn't play out equally on all populations. And when I think about vulnerability to the effects of climate change, I divide it into 2 populations. There are those that are vulnerable by physiology. So that includes infants, elderly, those with various levels of ability, and pregnant individuals. And then those populations are made vulnerable by racism and poverty. And a good example of the latter is the Chicago heat wave in 1995. A disproportionate number of Black Americans died during that heat wave. And they went back afterwards to do community surveys to understand why. Many residents reported not feeling safe opening a window because they lived in overpoliced neighborhoods. So people literally baked inside their homes because they didn't feel safe opening a window to cool down. We also know that urban areas, particularly areas that have been traditionally redlined, tend to be much hotter than other parts of a city where there might be more green canopy or less cement, less asphalt that really takes that heat in and absorbs it. That difference can be between 1 to 7 degrees on a hot day. In places like Montana, we face the same challenges in the Bay Area. Bay Area is a place where we are not, it's traditionally been a Mediterranean climate or a cooler climate. So the vast majority of households there do not have access to air conditioning. They haven't needed it. With the last few years, we're starting to see the demand for air conditioning skyrocket because there's more and more need for it as we're seeing more and more of these hot days. And the same is true here in Montana. It looks here in the state as well. There are more and more people that are trying to purchase air conditioning, but that's for a family that can afford it. There are a number of families that won't be able to afford the ability to stay cool on a hot day, or won't be able to run that air conditioning on a hot day. When we think about populations that are vulnerable by physiology, I really like this graphic at the front, at the top, that talks about pregnant individuals, those that are poor or displaced, children, the elderly, athletes, and outdoor workers. So pregnant individuals are at higher risk for birth outcomes. There's good evidence for both premature birth and low birth weight infants. There is still emerging evidence for a risk of stillbirth from exposure to heat. Infants in particular can't effectively thermoregulate in the first week of life. And there was a good study out of Spain that looked at and found a higher risk of mortality in that first week of life if an infant was born during a heat wave. I've now cared for a number of infants over the years who come in either with hyponatremia, the parents were getting water because they thought that if there was a heat wave, they should be giving their infants water, or hypernatremia, they were over bundling their infant, and the infant came in with severe dehydration. I remember caring for it was a teenage couple, and so they were young, and they really hung on the advice of the health providers they were interfacing with because they didn't feel confident as new parents. Well, they had their infant in an unair-conditioned apartment in Oakland. They had bundled the infant the way the nurse had told them to, and the infant basically became severely dehydrated. And they were tearful because they felt like they had done something wrong. And they said, when we followed all the advice, we didn't mean to hurt our baby. And it was really a sobering moment for me to understand that we haven't trained health professionals to really build environmental threats and environmental counseling into our work. And then finally, outdoor workers may not have protections in place to places to cool down during periods of extreme heat. I cared for a 16-year-old who had to be admitted because he'd come unaccompanied from Mexico. He was hauling brick in 108-degree weather. His creatinine was tripled. He had rhabdomyolysis. Now he was 16, so we were able to reverse all that pretty quickly. But we know that outdoor workers in particular, they take hit after hit to their kidneys, and it can cause chronic kidney disease down the line. There was a really sad story in Oregon during the heat dome where a farm worker collapsed and died out on that really hot day. And it took an event that severe for Oregon to start passing legislation to better protect outdoor workers during periods of extreme heat. But there's so much more work to do in this space. As I mentioned, there is emerging evidence around the effects of air pollution and heat in terms of adverse birth outcomes. So this was a paper by Bakar et al. That found that heat and air pollution are associated with preterm birth and low birth weight infants, with marked racial disparities, particularly Black and Hispanic women. And what is behind those disparities? So first is the fact that Black and Hispanic individuals are more likely to be exposed to air pollution, which we know is itself a driver for poor outcomes. Poor access to prenatal care, and then of course the toxic effects of racism on the mother's health. So what can we as health professionals do? I put an example here. I think Alameda County, and then again, I know California the best in terms of what our counties are doing. And so I often will put Alameda up as an example because I think they're really one of our leaders in the state of California. They've long had a really great website with resources around heat preparedness. They have a heat index map, so you know which parts of the county are going to be the hottest for the residents, and then they have easy access to their cooling centers, something that our counties are doing a better job of. But 3 years ago, when the pandemic hit, we had so places of public cooling were shut down. We had wildfires and heat at the same time. It was really hard to find a place that we could send our residents to where they could feel safe during those periods of both of those threats at the same time. And having learned from that, our counties are now doing a better job to provide those resources. And I did find this resource here from Montana, where you can call 211 for assistance or referrals to cooling centers. But if anyone here has experience with it that you're willing to share, I'd love to hear it if anybody has for further occasion. A resource to think about in terms of what you can do as health professionals to help your patient safe. And I have now built it standardly into my counseling for my families with newborns. But what we ran into, so I was doing my counseling about heat waves and keeping my patients safe, and this was during Labor Day weekend. And then I had a couple who had no air conditioning in their home and initially had no place to go. And then I started talking about cooling centers, and they looked at me like I was crazy because then I remembered, you know, as a mom to a brand new baby, am I going to want to go sit in a public center with my baby? Of course not. And so we had our social worker come and kind of call around to different family members, and they found one of their aunts that had air conditioning where they could stay with them to be safe. But even the cooling center isn't the perfect solution for the entirety of our population. I also wanted to shout out this resource that Virginia Clinicians for Climate Action built as something to be thinking about to develop. So they worked with their Department of Public Health to create resources specifically around the athlete community and thinking about how to stay safe during periods of extreme heat. But what we've learned from our Department of Public Health is that they're in process of building a lot of these materials, and they often do want to partner with health professionals to build these resources. So I've talked a lot about the problems, but I also want to create a vision for the solutions that we're talking about. These are just some examples of how cities are starting to reclaim space away from being reliant on cars and fossil fuel and towards more nature-based solutions that promote beauty and inspiration and connectedness and active activity like walking or biking. So in St. Louis, they tore down or really changed this area that was a big a highway that went through the city and created this beautiful park green space. In New York, they took a decommissioned rail line and built a beautiful green walking space over it. And then in Boston, they tore down the Rose Kennedy freeway here to build this beautiful greenway. And again, there's a lot more work to do in the space, but I think the momentum and the impetus and the awareness is there. It just takes people getting involved on a local level to drive more of these kinds of projects. Any questions on that before I move on to drought and pollution? So, I put these two together. You know, there are myriad health effects from drought that I'll talk a little bit about. But drought also makes air pollution worse. And I wanted to focus on air pollution specifically because it is a major driver for premature death. And we know that the benefits of switching to renewables are immediate in terms of health, in terms of cleaner air. And so I did just want to talk briefly about wildfire smoke and air pollution, PM 2.5 in particular. So particulate matter pollution, this is when we burn anything, whether you're burning fossil fuels or whether an entire house goes up in flames. It forms these tiny particles that combine with liquid droplets. And these particles are so small, we can inhale them in, they enter our lungs and our vasculature and essentially set off an inflammation cascade. We have very good evidence. So this graphic here on the bottom is the all the data we have on the burning of fossil fuels and when we breathe that in, what it does to our health. And so chronic exposures to PM 2.5 pollution cause shorter life, stroke, heart disease, asthma, lung cancer, reduced lung function, or low birth weight. The outcome in green, the health harms in green are the ones that we have emerging evidence, and the ones in red is where we have very good evidence for. And wildfire smoke, you know, is about 10 times as harmful to children as compared to regular air pollution. What this study did is it looked at an air quality index of 50 when it was just fossil fuel pollution versus when it was predominantly wildfire pollution. So apples to apples, the same AQI. And they saw a 10 times higher number of children showing up in the emergency room with respiratory complaints during periods of wildfire. And so what that says to us is that our air quality guidance really isn't accurate in terms of when we should be counting people to take protective measures in terms of their health, because we can't count those two forms of pollution as the same. Droughts and health. So this is the graphic from the CDC, and as I mentioned, there are myriad health effects from drought. So it can cause anxiety and depression. It changes the amounts and patterns of certain kinds of disease. It intensifies heat waves, and it stresses county systems for water. In places in California, there are places that are increasingly becoming ghost towns because there isn't enough municipal water supply there. And so people are just moving out of those towns now in the central California. But in terms of air pollution, they also intensify wildfires and dust storms with an increased number of particulates in the air that people can breathe in and exacerbates chronic respiratory conditions and asthma. As you can imagine, it's very hard to determine what number of deaths are attributable to fossil fuel pollution. And so I like this graphic. It looks across a number of different papers. And the one that's considered the best applicable to us in terms of anthropogenic sources, so human-driven causes of air pollution, is a Lillaville paper from 2019. And you can see that their estimate of deaths due to air pollution from all anthropogenic sources is about 5.5 million people globally. I wanted to just put up this graphic to me as what not to do when we're communicating this information. So this really describes some disparities in terms of asthma outcomes, but it doesn't explain the structural reasons behind it. And I think we as health professionals need to be very thoughtful when we're discussing what these disparities are, that we are concurrently talking about why those exist to shed a light on the injustices behind these outcomes. So Black children are 4 times as likely to die from asthma compared to a white child. Hispanic children are twice as likely to die from asthma compared to a non-Hispanic white. And what's behind that? So we have very good evidence that being Black is the single greatest predictor for your exposure to air pollution in this country, regardless of income. There's been historic redlining in this country that has really pushed communities of color close to these areas of pollution. So from the time a child is in utero, there was a study that came out that showed that air pollution crosses the placenta and they found PM 2.5 in a growing fetus. So from the time they're a fetus, they're exposed to this really toxic air pollution. They come out, their lungs are in the first 5 years is a period of rapid lung development, and they're breathing in that foul air. So from the beginning, they have a higher risk to develop asthma. You listen to this, the fact that a Black family, for example, is less likely to be able to afford their asthma medication, so it's more likely to show up in extremis when they come into an emergency room or clinic. And then you layer into that the fact that a Black versus a white patient receives different care when they arrive, because we take their symptoms with different seriousness or severity. And then you have these entirely unjust outcomes where a Black child is 4 times as likely to die compared to a white child. I do want to say one other thing about some of these disparities, especially as it applies to Hispanic children. There is some data that there are genetic differences in Hispanic children that drive some of these differences. So genetics is certainly some component of this, but structural is far away a much greater cause in terms of these outcomes that we see.
Question, Lisa. Here in Montana, the Black population is not as huge number here, and urban population is not that big either. But do you have any information on our Native American population regarding that? Is our biggest minority?
I don't know that data quite as well. I know it a little bit as it applies to wildfires, in that Native Americans are 6 times more likely to experience the ill effects in terms of displacement because of their forced concentration on reservations, but not in terms of asthma. I don't know that data quite as well.
Lisa, do you mind repeating the question into the microphone?
Oh, yeah. The question was, in Montana, there's not a large Black American population, nor is there a large urban population. So did I know the data for Native Americans? And that, I don't know if anybody in the room happens to know that data better than I do. I want to share. And these are, again, some examples for us, and I don't know Montana quite as well, but I did want to provide some examples for what in historic environmental injustice looked like. In Richmond, again, this is an area where 30% of the population is Black American. They've been somewhat forced into these areas because they're not desirable places to live. And there has been, on the one hand, there has been lots of pollution from the Chevron refinery that's there. It has also resulted in a lot of community activism and a lot of coalition building in that area to really fight the Chevron refinery and build solutions. So they, for example, there's an environmental organization there that has created a community climate resilience center around a youth center where youth can get a lot of programming and activity, and it's a safe place for them to be during periods of climate extremes. The aromatic hazardous waste plant, this was also cited as an area that had a higher minoritized population. A youth activist movement actually helped to get that plant decommissioned. And then West Oakland, this was an area, it was a previously thriving Black American community. A freeway was built around it to really privilege the commuters that were coming in to work in Oakland. And the health outcomes in that little belt are much worse in terms of cardiovascular and asthma outcomes. But again, a very thriving community organization, it's called the West Oakland Environmental Indicators Project, has come together to do a lot of work on advocacy, on helping homes come up with solutions to help clean up their air. That's been really remarkable. The final piece I wanted to talk about, because I can't, as a pediatrician, talk about children or climate change and not talk about mental health. We understand that there's a mental health emergency in our children currently. We know that children need safe, stable, and nurturing environments to thrive, and disasters, particularly recurrent ones, expose children repeatedly to these events. We have good evidence now that toxic effects, so things like racism, poverty, housing insecurity, a mental caregiver that themselves has a mental illness, racism, these literally affect the architecture of a child's brain. And the more of these toxic effects they see early on, the higher risk it faces them for a host of chronic conditions down the line. Worsening climate disasters make each one of these, poverty, housing insecurity, racism, make each one of these worse. And so as we think about creating a nurturing world, we have to think about the mental health of our children and creating these nurturing spaces from the time they're born. So how do I handle this as a provider in terms of my counseling? In my hospital, I care for NICU babies and then take care of FQHC newborns that are there. And so I always check in and then hospitalize kids as well. So with all my asthma patients, I will always talk to them about how to stay safe with air pollution, especially because we're seeing worsening wildfires. Many of my families cannot afford some of these air purifiers, which have gotten less expensive with time. Now you can buy a decent one on the market for $100, but even that might be out of reach for some of my families. So I will talk about a DIY filter that you can do that reduces about 50 to 60% of the pollution indoors. Box fan and a HEPA filter and either some tape or nails, basically, is all it takes. And there are some videos online that you can share with patients as well on how to make them. Again, as we think about what the future could look like, as we move away from fossil fuels and towards renewables, I like to put up this picture of a decommissioned oil rig, and it's turned into this beautiful ecosystem for marine wildlife because it turns out to be a really perfect substrate for marine wildlife to thrive and grow. And so this is what the world could look like if we moved away from fossil fuel infrastructure and more towards nature-based solutions and a beautiful and inspirational world. Transitioning to renewables and electrification, again, both decreases warming and has immediate health benefits by decreasing the air pollution that is driving a lot of these poor health outcomes. Any questions on that? Okay, I've laid out a lot of problems, but I always look at climate change as both our greatest health threat and our greatest health opportunity. And I like this graphic. Climate change is a big hoax, so we created a better world for nothing. And so when we look at what we're really advocating for, right? We're advocating for a sustainable world, green jobs, livable cities, clean air, clean water, and healthy children. I think these things are worth imagining and fighting for. I'll say actually my journey into climate change was actually 3 awakenings. My very first one was when I was 18 and I was introduced to Carl Sagan. And that's what led me into a path on ecology and evolution. And so there are times when I myself feel discouraged. And I love to go back to Carl Sagan's work because he inspired me at the very beginning and he still inspires me now. And I love this quote from him. He wrote, "From the distant vantage point, the earth might not seem of particular interest, but for us, it's different. Consider again that dot. That's here, that's home, that's us. On it, everyone you love, everyone you know, everyone you ever heard of, every human being who ever was, lived out their lives. The aggregate of our joy and suffering, thousands of constant religions, ideologies, and economic doctrines, every hunter and forager, every hero and coward, every creator and supporter of civilization, every king and peasant, every young couple in love, every mother and father, hopeful child, inventor and explorer, every teacher of morals, every corrupt politician, every superstar, every supreme leader, every saint and sinner in the history of our species lived there on a mote of dust suspended in a sunbeam." And what I think he does so well is that he makes us feel both big and small at the same time. And there's some awe in that to say that there's been so much that came before us. There will be so much that will follow us after this. But what role can we play in this very moment? When we are such a special thing in this universe that otherwise seems so big and we might be the only ones in it. So I take that large step back and then I take a large step in, and these are my 2 kids. They are now 4 and 7. They're not this young anymore, but they'll always be this young in my mind. I think any parent can identify with me. But for me, when I think what really drives me in this work is that I consider climate change like a big bus barreling down on my kids. And who of us wouldn't throw ourselves in front of that bus to make sure that our kids are safe? So when radical change is needed, many argue that it's impossible for individual action to drive it. It's futile for anyone to try. This is completely the opposite of the truth. The impotence of individual action is the reason for everyone to try. What can we as health professionals do? I think most of you probably know this data, that health professionals are very trusted messengers to the public. There actually has been recent data out of Gallup, even looking at what happened during the pandemic when we heard so many opposing voices on what we were supposed to do that could be very confusing. Even despite that, health professionals are the most trusted voices to the public. Nurses, number 1, medical doctors and pharmacists, number 3 and 4. And so we really have an opportunity to take an issue that has been
Engineers, number two.
The engineer number two. Sorry to leave you off. But we have a real opportunity here, right, to take climate change out of the realm of nasty politics and remember then and really remind people that this is not an issue of politics. This is an issue of our existence and of our health. And so this shouldn't be a political issue. This should be an issue of how we care for one another and how we care for the planet. I just wanted to provide this resource that Lori actually helped with. This was an MOC2, a maintenance and certification module. Again, I couldn't cover all of the health harms here today, but there are an increasing number of resources that various medical societies are putting out where you can learn more and more about climate change and health specifically. All right, so here's my 5-step plan for climate action. And the first thing I will say, and you'll hear me say this over and over again, which is that climate change is a systemic problem that requires systemic solutions. Often when I give these lectures, I'll get questions about recycling or some of these other individual actions, and I will say, all those things are fine and good, but if you really want to move on climate, we really have to think of this as a large policy and structural issue. And the easiest thing you can do, really, in terms from a policy point of view, is to get registered to vote and to vote. And then bonus is to vote for leaders with plans as bold as the problem is big. And I think a number of you were visiting your elected decision makers yesterday to really drive home this point that this is an issue that matters to health professionals. This is an issue that matters to constituents as well. And these are just some resources. We at the Medical Society Consortium will be working very closely on. There's unfortunately, because climate change is a politicized issue, we wouldn't message to vote on climate, but we can get more of our patients registered to vote. So VoteER is a fantastic resource. There's an organization called the Environmental Voters Project that specifically looks at voters who care about the environment and again, turns them out to vote. Not talking about climate, but just trying to create voting as a civic duty for those that care about the environment. And then we every year put out a candidate questions guide and try to encourage our advocates to join forces with other organizations in their state to create candidate forums where you can really press the candidates on what their solutions are for climate in a bipartisan manner to show that this is an issue that matters to constituents. Sustainable healthcare, and I know you all are going to get a great lecture from Beth all on this, but I did want to give a shout out for Health and Human Services last year launched a pledge. Thanks to that pledge, I believe over 100 medical or healthcare institutions signed up for that pledge for carbon neutrality. We are actually in conversation with HHS right now to try to reopen that pledge because we found it such a powerful tool for organizing. So stay tuned, we're hoping to get there. Joining a group. So again, this is a systemic problem and trying to go at it alone is generally both ineffectual, but also it isn't sustaining. When the winds come in this work, they are huge. But in between, there can be a lot of losses that can feel hard to deal with. And when you go through it with the community together, it keeps you sustained going through it. So even when you face the loss, you're there for each other. When you face the win, you get to celebrate together. These are some of the organizations that, like you all are here for Montana Healthy Professionals for a Healthy Climate. There's Physicians for Social Responsibility. There's the consortium. There are tons of organizations where you can get involved. The most important thing is finding your community and then signing up and showing up. You can talk to and counsel your patients. I really like this resource that one of my colleagues, Dr. Phillips Horn, has created. Often we'll hear, well, there's not time to talk about climate change during my patient encounter. I'm having to talk about so many other issues. And so what they did in this paper was it wasn't adding any information on, wasn't asking an additional question. It was bringing a climate lens to the questions that you're probably already asking. So whether you're asking them about nutrition or you're talking to them about exercise, these are opportunities to build in some climate counseling to really drive home the point that climate change is an issue of health. And there are things that you can do in your daily life that are both good for your health and for the health of the planet. And then very finally, this is the last thing, is this individual action. And we have really good data that the fossil fuel industry drove things like recycling programs or messaging to the public that if you drive a gas-powered car, well, you're the problem, you're the guilty one, and really trying to depress the action on climate change. And so I tell people you can drive a gas-powered car and still be an advocate for climate and health policies. This is a structural problem. Industries have largely been able to use their dollars and their lobbying influence to keep us dependent on fossil fuels when we could have started making that transition a long time ago. And so really, if you take those actions, that's great. But what's so much more important than taking that action is talking to others about the fact that you are taking that action. So whether you decide to bike more, walk more, if you can get solar on your rooftop, if you're making changes to your diet, that's all great. But really, in terms of thinking about this as a systemic problem, talk to others about what you're doing and why you're doing it to try to spread that action out across others and that awareness out across others. So the problem is big, but so is the opportunity for change. I encourage you to join, if you're not already a part of Montana Health Professionals for a Healthy Future. This is also just an opportunity to join our newsletter to learn more about ways you can get involved. I will take any questions. Yeah, so the question was, what is it within wildfire smoke that makes it more toxic than air pollution? That's a good question, and I will say I don't know all the chemistry behind it. I'll look forward to the lecture later today that dives into it. But we understand that some of those chemicals have a far more carcinogenic and far more inflammatory component to it than fossil fuel pollution. And so you can imagine, right, if things are going up into the air like a paint thinner, when you burn a house, that when it's burned is going to have a very different effect on the body than burning a fossil fuel. But I'll look forward to the lecture later that might dive into this more. Yeah.
Someone from the chat asked, can we get the citation on how to talk to patients about climate change?
Oh, sure. Yeah, I can look that up and put it in the Zoom link.
Great, thank you.
Yeah.
How is politicized and is the companies going to be in control, like Google? And, it's kind of difficult to wrap my head around that.
Yeah.
And how do you do that as terms being used a lot in very structural?
Yeah, so the question was, as these companies pledge carbon neutrality, and I think this is the heart of the question, are they actually doing it, or are they just doing it for attention? So the term is greenwashing, and I think that we have reason to be concerned that there are a number of organizations who are making claims about what they're going to do for purposes of their image, but not really making those internal commitments to actually reach them. In California, there is legislation that has been considered a number of years and it's been shot down to actually force companies to publicly share what their carbon emissions are, so that when they post what those neutrality goals are, people actually know if they're actually trying to achieve them. We're not there yet, but I think that's an important step to hold corporations to account when they claim that they're doing something about it. We should be able to see the data and show whether they are or whether they aren't.
Looks like someone online raised their hands, so let me see if they have questions.
Sharon, did you have a question from online?
I just, as a nurse, when I worked in Arizona, the health effects of the,
Yeah, Sharon, can you type it into the chat? I don't think we can hear you.
okay, let me try here.
Any other questions while reading on the one on Zoom? I saw a couple more hands.
I'm just wondering about, in Montana, when we have seasonal wildfire episodes, and, looking at the important drivers of, the child, particularly, challenging problems. So looking at rectifying, the actual impact of those seasonal events versus maybe some of our ongoing indoor air quality issues that we continue to struggle with. Just really put that in perspective of actual risk from seasonal wildfire episodes versus the, say, control diseases that are, local.
It's a really good question. And, I think we're doing more and more work to understand attribution a little bit more. So as an example, I don't know how many of you saw the paper that came out that said that about 13% of asthma cases in the country are because of gas stoves, for example. I don't know region by region because it's going to depend on what pests are there. If you live close to a fossil fuel polluting industry, if you have a gas stove within your home, if there is a family history of asthma, right? Each of these things is going to play out differently. So I don't have a great answer to that. I will say now that I've seen the gas stove attribution study, I do make it a standard part of my counseling to my families with asthma. And then it has just become my standard practice with in California anyway. We no longer have a discrete wildfire season. It is more or less year round, and it is more or less yearly. And so it's become a standard part of my counseling because the patterns have changed so rapidly. It behooves me to do that counseling. And I know less about how the wildfire season has changed here in Montana. Would you say that it's become longer?
Fires in December.
I think it's on average about 2.5 months longer than it used to be 20 years ago.
Okay. Yeah.
So I'm an engineer here, probably the only one, I don't know. But I hear all this talk about renewable energy. So many people overlook the fact that we today in the United States get 50% of our emissions-free energy, electricity, from nuclear. And there are some really good new advanced reactor systems that are being developed that I hope you all as professionals will take a close look at, because I think that is the future of clean energy.
It's a very controversial topic. So Physicians for Social Responsibility is very anti-nuclear as part of energy solutions. I think most of us believe that if we do want to decarbonize, nuclear will be some part of the solution. We have, as a consortium, haven't really developed a stance on it because I think this is complicated. If you ask me personally, what trust on it, what I feel about it, I do think nuclear will have to be a part of it in the bridge, but I hope that it is not a part of our long-term solution. And I know less about it, frankly, as an engineer, but I think the primary concern is how you deal with that waste, and then the possibility of some of the incidents we've seen in terms of safety. Oh, yeah, go ahead. I'd love to hear from you.
Saying no more, no more, no more. Heard of all this before. I'll just say this quickly. Some of the new small modular reactors have the potential to recycle the existing waste from nuclear power plants.
Yeah.
So there's potential for a waste to energy solution to climate change. I hope medical professionals will take a little closer look at nuclear because it does have a bad name because of the waste issue.
Yeah.
Now, my wife has her say.
I'm just going to read Sharon's question from online here. So she says, in Arizona, we would see older patients with fluid overload trying to stay hydrated. Do you see those effects in California during the heat waves?
Oh, interesting. I'm a pediatrician, so
Please repeat.
huh?
Please
Oh,
repeat.
sorry. So the question was, it's a listener from Arizona who would see patients on fluid overload during periods of heat wave because they were trying to stay hydrated because of the extreme heat, and then ended up in a situation where they probably needed to be diuresed. That isn't clinically my practice. I tend to deal much more with athletes or outdoor workers or infants that get into periods of severe dehydration. And so the problem for us is really dehydration without any sequela. But I'm curious whether anybody else here has experienced that. So we want to share. Any other questions?
I was wondering if you have any commentary on how water resources are fitting into your conversations around the health impacts of climate, particularly with people in child health or in medicine. And, for us in Montana, satellite imagery shows we're kind of blue in that sense. We have water here,
Yeah.
but it's not an infinite resource.
Yeah.
And so certainly in your region, you know, it gets a lot more attention. It's hard to imagine how that conversation exists on the ground here.
Yeah.
Or what lessons we may be looking for to have that conversation early.
Yeah. It is a big, so the biggest issue is really in Southern California because they get a lot of their water from, oh, sorry, the question was, how are we thinking about counseling around water and children's health? As we look at both access to both water availability and then a pure water supply, because we are, you know, there are places like Flint, Michigan, for example, or Jackson, Mississippi, that are dealing with a contaminated or an inability to clean their water supply. Region to region, I think it's going to be different. Where I work up in Northern California, I'll say it's not a standard part of my counseling with my families because we have not yet run into a water access issue where I am. I think in places in like Southern California where people are probably following what's happening with the Colorado River, where the levels have gotten so low that the federal government looks like it's going to have to step in to help states come up with some agreement on how to use that water. There, I think messages on water conservation are going to become increasingly important. There is a city that outside of Arizona, outside of some municipality in Arizona, which was like an unincorporated area where they're basically being cut off from the water supply as a water conservation measure. And these are people that purchase these new homes out here and they don't know what their future looks like because there isn't going to be access to water there moving forward. So these issues are very complicated and they're holding out real time. And I don't have a great answer to it beyond understanding what their local context is and what you need to advocate for in terms of resources. So in places like Jackson, for example, where the infrastructure has been so underinvested over the years, I think there's a real opportunity to bring more advocates in, to bring more resources to build up their water infrastructure systems, for example. But I think place to place, the issues of water are going to be complex and different. Yeah.
Regarding the air quality inside a home from gas stoves, is it true that it's also affected by gas heating and cooling, and then gas appliances? And then the second question, do you know if it's true that in 6 months to a year, there will be rebates for changing out appliances?
Yep. So the Inflation Reduction Act does have, you know, what the Inflation Reduction Act really tries to do is create lots of carrots. So tax incentives, credits to install heat pumps for induction cooktops. I don't know. I know that they're in the middle of shaping all those dollars right now. I don't know if the time frame is 6 months to a year, but it is something that's built into the IRA for consumers to be able to access. And then the second part of your question, yes, all of that fossil gas infrastructure can indoor air quality. I would say gas stoves are by and large the bigger one, but the other ones do as well. The issue with it is that it is both a human health issue and a planetary health one, because what we've learned is that even when you have those gas stoves shut off, it's still leaking a significant amount of methane gas that previously we didn't understand was a part of significant warming. So getting rid of that infrastructure is good both for climate change and it's good for human health. Yeah.
Referring to air pollution, what is your opinion from Montana about the carbon tax act?
Oh, I don't know about the Carbon Tax Act.
Oh, it's a tax on fossil fuels.
Mm-hmm.
So it's like trying to push green, really, electricity. So
yeah, so because of the work that I do, we really try to forward policies that would take us away from fossil fuels towards renewable energy. So just on the face of it, not knowing everything about this policy, I would say the lines of what we're trying to accomplish. I think I should probably hold time here to stay on time.
Yeah, we're
Oh, okay. Any more questions?
So I'm just curious, in your work with the consortium, do you feel like we're getting more traction as health professionals on this issue?
Oh, absolutely. We actually, there's a big coalition called Climate Action Coalition that traditionally has worked a lot more with environmental organizations. They're organizing a whole public health week because they know, we all know this from the data, is that the health message is the most resonant and the most bipartisan when we deliver on a health message. And so increasingly environmental organizations are starting to bring the health message more and more into their work. So, you know, I think we're at a tipping point in terms of reframing this conversation that's really exciting to be a part of.
I have a question. So to tackle the health effects of climate change, we need to focus on both prevention of future climate change, but also amelioration of the current effects. But with limited resources, it's hard to do both. So what do you see as the optimal division between prevention and amelioration?
That's such a good question. And there was there's actually an article, I think a couple of days ago, a paper that came out about warning us against what's called, the question was, what percentage of our efforts should be spent on mitigation and what percentage should be spent on adaptation, understanding that our resources are somewhat limited. And so there was a paper that came out that was counseling us against the doom loop in terms of, there's, I think, more attention currently being paid on adaptation than mitigation as we look on like local and state level resources. And we need to adapt, especially because there are certain populations that wouldn't have those resources to stay. They don't have resources to stay safe now, let alone from a worsening climate. But the issue is that if we don't keep our eye on mitigation, there's just no amount of adaptation that can really protect us down the line. And so in my perfect world, we'd be very thoughtful about the resources towards mitigation that really targets those that are most vulnerable to the effects of climate change, to be very thoughtful about those resources, and the rest of our efforts would be spent on mitigation.
I'm very interested in how indigenous communities are, and maybe you don't have a lot of data on this, but I was just curious, because indigenous communities, I mean, the heart of who they are, they live off the land, I'm sure they're doing artists. How is this information being brought to these communities? I know that they have their own healthcare system, but who's really driving the information into those communities?
Yeah, and I think, and again, I'll speak to local context a little bit. And again, I think all of this has evolved quickly in California because the wildfires got so much worse. But during those periods of wildfire on a lot of those reservations, they were being hit with really bad wildfire smoke and didn't have the resources to keep their residents safe. So there are increasing number of opportunities that we have in our governance structure to thoughtfully integrate those voices. But you're exactly right. We, within each state, within each locality, we really need to ensure that those that did very little to contribute to climate change, but are being really hard hit with it, have a seat at the table. And I think this is where also health professionals are very important, is that we can advocate for those people to have a seat at the table.
I would also say that some of our tribes, the CSKT and Blackfeet, they have climate change plans. And so there are folks within those communities who are also really working on this, and we can certainly be allies, but also make sure that they feel empowered to tackle any issues too from their campus.
Okay. Thank you.